You know, Zora, like your teachers, professionals working in the field of early childhood have met many children and have a lot of experience in the development and behaviour that we can expect at a certain age and in certain situations. Nurseries are privileged places of observation, on the one hand because of the unpredictability of children, and on the other hand because of the expertise that educators have about typical development. So educators have a natural observation setting. They can report observations to the paediatrician that would otherwise not be seen in a doctor's office, and often not even at home because perhaps the environment has adapted a little to the child. We are also the first social context in which the child is placed, even if not all children go to nursery school. There are many advantages seeing a child placed in a context of rules, in a well-defined structure, with their own routine and with other children, can certainly be a way of starting to highlight difficulties, should there be any. The nursery is a place where children spend many hours in a play environment with other children of the same age. And this can be a place where they can see what behaviour is normal and what behaviour is abnormal.
Nella norma e quali invece possono essere dei comportamenti anomali.
An educator has in mind the development of that child, and therefore, if problems or doubts arise, this is one of the first important key aspects that the practitioner can think about. In my opinion, the role of early childhood practitioners is fundamental in identifying autism spectrum disorder. They spend all day and every moment with the group of children, so they have a global perspective. Obviously, it is important to have theoretical knowledge, first of all, about typical child development. And then, in training as a childhood educator, training on the topic of autism is also offered. As early childhood educators, we have already learned and ingrained within ourselves the tool of observation. However, it is not always as clear how to observe these behaviours. Having been taught at school about autism spectrum disorder, the manual Campanelli Verdi e Rossi, green and red flags, gives professionals a reference point to begin targeted observations. This is because it is important not only to observe, but also to know what to do with these observations. Of course, we do not expect educators to become specialists in this disorder, but they do at least have a point of reference where they can put together their observations, and then by sharing them with the team, they can start to reflect. The Campanelli Verdi e Rossi manual was born out of a desire to contribute to lowering the age of diagnosis of autism spectrum disorders through the involvement of the professionals working in early childhood. We know that the sooner a diagnosis is made, the sooner the child and his or her family have access to appropriate intervention. In this early stage of development, from birth to 4 to 5 years of age, the brain has an enormous amount of neurons. These neurons connect to each other, and their capacities can be increased through stimulation. It is an extremely receptive phase, and that is why, if we find or see difficulties in the child's development, this is the best time to intervene with stimulation.
Nella maturazione del bambino ci sono delle difficoltà, a questo punto è il momento migliore per poter intervenire con una stimolazione.
It is important to be able to intervene in order to improve the skills of these children. It therefore remains essential to be able to intervene as early as possible. So let's say that the sooner we manage to make the diagnosis, the sooner we allow the child to have the chance to acquire strategies that allow him or her to have a favourable prognosis. It may be difficult for a paediatrician to do this, but daily observation, for example in a nursery school or in environments where there are people who can observe the child, can reveal more obvious signs. Therefore, together with the family, this information should be passed on to the paediatrician so that he or she can understand whether or not we are dealing with a child who is experiencing difficulties in his or her development. It is important that educators are able to understand whether the child's manifestations may or may not be of concern. The manual Campanelli Verdi e Rossi enables the educator to assess whether what the child is displaying is actually part of a possible autistic spectrum disorder, or whether it is other manifestations that have nothing to do with this disorder. The journey of people with autism spectrum disorder is complex. It is complex because it changes over time. It is also complex because it depends on the context and the geographical area in which the person grows up, evolves, and in which the person and his or her family live. Campanelli Verdi e Rossi is intended to support people with autism spectrum disorder and their families. It is aimed at a group of professionals who, in our view, are important, but who, from what we observe, had not been fully taken into account when it came to identifying autism spectrum disorders at an early age. The nursery setting gives you this opportunity to see the child's development alongside other children, although comparison is never the main thing to focus on, especially with children who are perhaps developing different abilities at different times. Some start walking earlier, some start eating earlier, etc. And there are always numerous influences depending on the system in which they are placed, and thus the family and the cultural background they have. However, in macro areas of development, it is sometimes quite striking to see behaviour that is different from that of most children. How do children develop from 0 to 3 years old? What are the key elements to know in order to be able to identify that the child with autism develops differently from the norm? At the beginning of development, at birth, the child is focused on the sensory motor experience with their environment. They do not communicate in the true sense of the word, although we try to interpret their crying and manifestations to try to understand what they need. It is only from the age of 6 months to 1 year that we realize that the child has difficulty interacting with others. At first they respond to the stimuli they receive from others. Then around the age of 1 year there is a breakthrough in typical child development. They understand that they can get something from other people and begin non-verbal communicative interactions by showing their interest, expressing their requests by shouting, crying, or sometimes uttering single words.
par des cris, par des pleurs et parfois déjà par un mot ou un autre.
The typical development of babies is that they recognize their own name at an early stage. Talk to them often and they will soon recognize it. If you call a 1-year-old by their name, they will turn their head and look at you. Between 1 and 2 years old, the child evolves. They understand their environment much better. They interact with objects, with people. They grasp objects. They discover the world. They improve their understanding of their environment, their understanding of the human beings around them. This gives rise to intentional communication with others. One of the central elements of this communication is shared attention with other person for an object. The child, for example, will show an image to an adult to share it, attracting their attention. Look at this picture. They won't say it explicitly, of course, but they will get their attention and show them objects, asking them to name them. What's this? What's this and this? And the adult answers them. It is typical of the child who is developing communication. From the age of 1.5, 2 years, the child develops various games with objects. First they discover how they work, and then they play with them, symbolically so to speak. They assign them another function. For example, they take a pencil and they go brum, brum, brum. They thus discover the use of objects which are symbolic, which are representative, which are in their way of communicating with others, and attribute a meaning to these objects that is different from the original one. A practice which will soon lead them to play symbolically with other children, to develop fun games with them. But after the age of 3, children play fun games. They play mummy and daddy, doctor, etc. But only after the age of 3, it must be said. Between the ages of 2 and 3, the child develops language, has a kind of language explosion, and increasingly uses known words. This is a very important age for language development. At 2 years of age, the child is not very good at linguistic communication. Even if they use familiar words, they often need an interpreter, an adult who understands what they mean. How do you tell, in the light of typical development, that you are dealing with an autistic child? When do you notice the problem? What do you observe in daily life, when interacting with them or when they are playing with other children? Well, one of the first symptoms is in calling them by name. The autistic child has much more difficulty. It does not mean that they do not hear, that they are being called, but often they do not answer. Parents sometimes think their child is deaf. They call them Piero, Piero, but they don't answer. This is one of the first detectable differences in children with autism. The second developmental difference that is very striking are shared attention gestures for demonstrative purposes, also deictic gestures. For example, pointing, showing, giving, requesting. Sometimes autistic children ask questions. They have needs, which they also manage to express, but they have a lot of difficulty interacting with others. They make a few gestures to indicate, and you get the impression that they are not really communicating. Entering into communication means sharing ideas, thoughts, emotions with others, then sharing attention with the world. This is really one of the important symptoms which is not always systematic. Autistic children play differently with objects. They do not play symbolic games as the typical child does. They use objects in a symbolic way less, continuing to explore their functionality more. In the end, of course, I think the most obvious thing is they don't develop language like other children. So usually, but not necessarily, they will speak less, express less, and maybe not develop language at all, which is a great concern to the people who look after the child. How can you observe these signs? The best place to observe this difference is to monitor the child interacting with other children, since when they are in the company of an adult, it is the latter who determines their behaviour. When you go to the paediatrician, therefore, it is easy not to notice that they are autistic because they are in company of their mother, they are quiet, they are with their father, and they behave like a typical child. But when the child interacts with other children in the nursery or kindergarten, their behaviour will be more apparent, and early childhood professionals may realise that the child communicates differently from others, does not communicate like a typical child. Why is it so important to identify children with autism early? Because communication is a fundamental part of human development. It is through communication that we discover others, we discover the world, we learn to live. Having a communication impairment is a very serious condition. Therefore, it is crucial that as soon as we recognise that a child has an autistic spectrum disorder, we support them in communication. This has a preventive effect on future development and is very important for the child, for the parents, for the family, for their development. In order to prevent the negative consequences of communication disorders in children. Some alarm bells, some behaviours are more easily observed in a child's everyday environment and interactions and comparisons with peers. Hence the idea of being able to create a tool that can facilitate the observation and description of behaviour for professionals who do not have specific training in autism spectrum disorders. Observation in early childhood settings allows children to be observed in a context that is familiar to them, in a daily context for a longer duration, and in interaction and comparison with other children. These factors make it possible to identify any abnormal behaviour more clearly. Sometimes, however, it is difficult to describe them clearly and objectively. Hence the idea of developing a tool that can help both the identification and, above all, the description of these behaviours, so that we can be more effective in communicating and sharing what we observe with family members and professionals. In order to be able to make suitable observations, it is important to be aware of the fundamentals of typical child development. It was important for us to include this part in the manual, which Professor Eveline Thommen mentioned, in order to put some emphasis on early social and communication development, which can sometimes be taken for granted as children develop these skills naturally. It is also useful to have a vocabulary to describe what is the typical development of communication and socialization in the first years of life. This can serve, on the one hand, to enable more accurate observation, but also to be able to communicate in a specific and effective language to other people what we have observed. This will be very important in the drafting of the cards, and especially in communicating what we have observed. More and more often today, there are very early signs that occur in the first years and are represented above all by motor signals, in the sense of atypicalities, asymmetries, poor fluidity of movement, and by sensory signals that concern above all the visual side. With regard to the diagnostic criteria, these are represented by atypicality and inability to reciprocate on the social side, inability to put oneself in the shoes of others, and lack of spontaneous initiative towards others. At the same time, the other very important criterion is the narrowness of activities and interests, which means that some of these children, especially those with lower functioning, have many motor stereotypes, while others with high functioning have a characteristic focus on certain topics of interest to them and talk exclusively about these, regardless of whether the other person is interested.
E parlano esclusivamente di questi, non curandosi se l'altro possa essere più o meno interessato.
Another very important element is the focus on sensory anomalies, which, as we said, may precede the more strictly social part and may account for the fact that the non-filtering of all the sensory elements in the environment means that these children are overloaded by a whole series of stimuli And some hypothesize this leads to their detachment from social relations and adaptations to the environment.
porti a un loro distacco rispetto alle relazioni sociali, rispetto all'adattamento all'ambiente.
How can diagnosis be made? It is made through tests and without clinical impression. The tests are the ADOS, Autism Diagnostic Observation Schedule, which is a specific test that needs lengthy preparations and a long learning curve, or the ADI, Autism Diagnostic Interview. Then there are also others that are less specific tests. The other important part is our clinical impression, which is also made by free observation, beyond our specific study where we visit as doctors and psychologists, and it is an important part in relation to the school and educational context of the child. Hence the enormous importance of the signals that children can express in the wider, broader context involving early childhood workers. So, books such as Campanelli Verdi e Rossi are very useful tools. After that, there is clearly the communication to the parents, which does not mean communicating that these children have a diagnosis of autism spectrum disorder, but that there are suspicious elements that are somewhat atypical with respect to the child's age and skills, and therefore, as such, need more expert clinical judgment. It is very important to be able to observe the child in another environment, in a broader, freer way. And early childhood professionals can certainly be of help, both to us doctors and in our relationship with families. The idea of cards with drawings on them was already there at the beginning, before making the manual. The intention was to have some elements on these cards: the age, what to observe. A very important aspect for us was how to observe these behaviours. And then, in the cards as an initial idea, there was the desire to be able to distinguish green flags, so what we can consider typical in development, and red flags, behaviours that could be atypical and therefore could be reported as potentially problematic. When choosing the cards, the first consideration was what to include. Which behaviours? We did a literature search and looked for articles in the scientific literature dealing with the early signs of autism spectrum disorder. Then did a short synthesis and selected 25 behaviours to be included in the cards. Once the behaviours had been selected, our job was to translate what was written, often in English, into a language accessible to the target audience of the manual, i.e. early childhood workers. We also decided to have user-friendly, easily accessible and attractive graphics. Another aspect we considered when creating the observation cards was that the how to observe could be automatically inserted into the natural setting of the nursery. So that it didn't lead to having to create ad hoc, atypical and artificial situations, but that each card could allow observation simply by looking at what children usually do inside the nursery. This manual can be really useful for childcare workers. It is like a magnifying glass on children's behaviour. Let's take the example of item number 15, understanding the gesture of pointing. On the one hand, we have what to observe, Observe whether the child is looking in the correct direction when something is indicated. Next, we have the how to observe. In 5 different situations, point to the child an object or person that is less than 30 centimeters away from your finger. On the other hand, we specify criteria that allows us to confirm whether or not the highlighted behaviour has been acquired. Green flag if the child looks in the correct direction when pointing at a nearby object or person. Green flag means that the observed behaviour is expected behaviour for that age, and therefore should not be cause for concern. Red flag if the child does not look at the correct direction when pointing at a nearby object or person. Red flag, on the other hand, indicates that the observed behaviour has triggered a slight alarm and that it will therefore be important, based on this, to initiate a discussion and pay attention to the details of what has been observed. The results should be recorded on a note sheet attached to the manual.
Does the child react when called by their name? For instance, do they stop playing, turn around, or look at the speaker? That's a green bell. Does the child not react when called by their name? Meaning, they don't stop playing, turn around, or look towards the speaker? That's a red bell. Does the child spontaneously use the pointing gesture during the day to ask for something they want, or to attract attention towards something or someone? That's a green bell. Does the child not spontaneously use the pointing gesture during the day to ask for something they want or to attract attention towards something or someone? That's a red bell.
We have seen and discussed the importance of identifying early signs of an autism spectrum disorder. But then what? Why is it important? On the one hand, it is important because an early diagnosis makes it possible to activate an intervention early. It also makes it possible to respond immediately to the needs of families and to provide them all with the necessary support. The question that arises is, what kind of intervention is appropriate for an autistic spectrum disorder? This topic is broad and somewhat beyond the scope of our manual. However, we found it useful and necessary to ask an expert in the field of appropriate intervention what elements to take into consideration. Sometimes, the fear of labelling or stigmatizing the child by giving an early diagnosis of autism may prevail. This leads to 2 problems. The first is that if we wait, for example, 6 months, or for the child to go to school and so on, we are missing the fundamental opportunities, and the child would have to acquire all that framework of skills that we can teach through intervention. This would minimize symptoms and enable the child to participate and take advantage of the opportunities offered by interacting with peers at school. The second issue is that the diagnosis of autism itself shouldn't be stigmatizing. We need to think of people with autism as people who have roles to play, contributions to make, dreams to fulfill, and goals to achieve, not as people whose diagnosis is some kind of condemnation. It is not a pathology, nor is it a disease. It is a condition, a different way of being in the world that makes social learning difficult. So we must implement interventions, and we must implement them when the brains of the children with autism, like that of all other children, are particularly open to change. What are the most suitable interventions to achieve this? Equipping the child with skills that allow them to learn from the world of social relations that surrounds them, from school, family, and so on. What are these tools? We need to think about what we can call the social learning infrastructure, i.e., all the behaviours that facilitate and enable the child with autism to learn from others. So we have to teach spontaneous imitation and shared attention, the ability to share the focus of attention with another person, non-verbal communication, the use of gestures, eye contact, non-verbal language that precedes and facilitates the emission and acquisition of verbal behaviour, the sharing of affection, functional play, symbolic play are all pillars that support verbal language and the ability to learn from others, to participate in shared activities, and to take part in the opportunities that society offers. How can these different learning objectives be taught effectively? The research has documented how we can be successful in teaching these aspects using approaches that we call naturalistic development behavioral. They are approaches in which we start from what the child is motivated to do, from the goal that the child has when, for example, they are given options between different play activities, between different objects. You follow that initiative. You join the child and try to take the child from an interest in a solitary activity to an interest in the same activity done in pairs, and you insert episodes of teaching. This is the behavioural aspect, i.e., episodes in which you give the child an input, an instruction that will facilitate the target behaviour. What I want to see in the child, what I want the child to acquire, and that will be associated with a positive consequence, a reinforcement. All this in the context of daily routines. Of course, these concepts then have to be translated into intervention practices, which are quite complex and require specific training. Typically, what they have in common is that they start from a specific assessment of the child, their weaknesses and strengths. It starts with building clear short-term goals, clearly expressed behaviours. I want to teach them to point to share interest, follow instructions during the play routine, and so on. Autism is a condition characterized by a profound heterogeneity, by a variable way in which symptoms present themselves, even in various stages of development. However, if we think of autism not as a disease for which there is a cure, but as a particular developmental pathway in which certain supports can facilitate the acquisition of important skills for the child, then this pathway must be thought of in the same way as the learning pathway of a child with typical development. The typical development child learns continuously in the daily routine. They learn at home, but also at school, when they go to preschool or nursery school. These are the contexts in which we need to think about intervention for the child with autism. How can I incorporate technical learning strategies that facilitate the acquisition of new behaviours in nursery school, preschool, and at home? By supporting parents and through specific therapies such as speech therapy, psychomotricity, and all the therapies that can be implemented. Then there is the role of the family. The family plays a fundamental role, especially when the child is very young. First of all, the family has to establish together with the practitioners what goals they want to work on. We cannot create teaching goals, intervention goals that are disconnected from the goals that the family has. So, the starting point for effective intervention, once the diagnosis has been established, is to sit down with the family and say, okay, this diagnosis means that the child has these strengths, because we always have to talk about strengths, and also these weaknesses. What do we do to address these weaknesses? What do they teach the child? What behaviours do we teach that will help the child turn these weaknesses into things the child has learned to do? Because a child who does not speak can learn to speak. A child who does not point can learn to point. A child who cannot play can learn to play. We have to teach versatility, and we have to agree with the parents what the starting point is. What is the priority? What is important for them? This is the first decision, and the second decision is how we teach these behaviours. I agree with the family and say, okay, if we want to do this, let's try to do it together. As a professional, I work, for example, by meeting with the family once a week for 1 hour and asking the family how it went in the work that they are doing to facilitate that behaviour. In general, the important thing is to establish precise shared guidelines, not vague or chaotic ones. We are working on doing these 3 things, indicating between 2 different options when I offer 2 options to the child, for example, and any other skills we have decided to prioritize in the context of a shared decision with the family. When I do all this, my task is to accompany the family along the way from the initial learning of this skill to verify that this behaviour, this skill that I was teaching has been acquired by the child, and to move on to the next skill.
Acquisita dal bambino e passare all'abilità successiva.
Of course, this does not mean that the parent has to take the place of the practitioner. What I can ask of the family must be proportional to what the family can do, without, however, leading the family, for example, to give up their work or reduce it in order to stay at home and do therapy.
Proprio lavoro, a passare dal lavoro full time al lavoro part time per stare in casa a fare la terapia.
This would be counterproductive in the long run. If the family then finds themselves missing out on professional opportunities or social contact with others that are fundamental to their well-being. These are choices that must be thought of in the context of what the family has available in terms of resources, but above all, without thinking of the family as a substitute for services, but as one of the parties involved in process of comprehensive care. This involves thinking about how I can equip the family in the best and most efficient way possible to carry out their role. The parental role, which is to educate their children and to educate them with special techniques that are due to the fact that they have a special child. The Campanelli Verdi e Rossi manual is an excellent supplementary tool to provide assistance to specialists when they suspect that something is amiss with the child. It is not at all easy for educational staff to communicate behavioural problems found in young children to parents. From the perspective of relatives, however, it is urgent and important to communicate the existence of a behavioural problem. It is important that parents address behavioural abnormalities. But it is equally important that parents are made aware of the child's developmental stages. It is important to communicate those too. We also believe it is very important to inform parents that there is a red flag behaviour that does not correspond to what is expected of the child, that requires further investigation promptly. Parents need to be shown how important it is to intervene, and even if they do not intervene, to be able to support the child so that they can acquire the necessary skills to make further progress. It is important to show the parents that they will not be left alone to deal with this situation, to refer them to other structures to which they can turn, and to show them that you are prepared to pass on your observations to a doctor, a person who will then carry out further investigations. I think it is important to show parents that they are not alone, in the sense that, for example, custody of the child will continue to be guaranteed even after such observations. Observation by educational staff and communication to parents of the child's unusual behaviour can trigger different reactions. It is not uncommon to see reactions of fear and uncertainty in parents, as parents do not know what this means for the child and whether this problem will negatively affect their future life. Some parents react with denial. No, I don't think so at all. Let the child be himself. Every child develops in a different way, and I think my son is developing normally. For some parents, learning this information is even a relief. A relief because they have the unpleasant feeling that something is not right in their child's development. Therefore, the information they receive from the educational staff is a relief, as someone else has noticed these anomalies. There are also combined reactions. There can be fear and relief, or fear combined with anger. The important thing, in our opinion, is that specialists recognize and take an interest in parental emotions, and that, in this precise situation, they do not take their reactions personally. Specialists must be well prepared and ready to clearly indicate the child's abnormal behaviours, communicating to parents that they need to react and showing them that the next step to take. It is true that, in the short term, early diagnosis can be a source of anxiety, insecurity and stress. But it is necessary to be able to think in the long term. In the long term, an early diagnosis enables the child to have access to important therapies to acquire the skills needed in daily life. Science has shown the importance of reacting promptly to behavioural abnormalities and providing the child with appropriate therapies so that they can progress. Children's educators are an enormously valuable resource in early diagnosis, which, in the long term, has a very positive effect on the quality of life of the family and also of those affected.
Positiven Effekt auf die Lebensqualität von Familien und auch Betroffenen haben.
The tool is part of a collaboration between various professionals, families and networking. It is focused on two fundamental aspects of the work, which are communication and observation. It is our hope that this manual will contribute to lowering the age of diagnosis and, together with appropriate intervention, makes a difference in the lives of children and their families. The items are designed for observing the child in their natural environment, so it should not be necessary to prepare specific situations or materials. The items are described on the basis of specific behaviours, so there should be no difference in the result if one person is observing rather than another. However, we suggest that every professional makes their own observations, and if red flags or anomalous behaviours emerge, ask a colleague to repeat the observations to verify the results obtained. There are 25 items described in the manual, but it is not necessary to set up 25 situations and observe the child in 25 different situations. It is possible that more than one behaviour can be observed in a situation, for example, a break time or play situation. The manual, Campanelli Verdi e Rossi, is not designed for intervention, but it describes the child's strengths and weaknesses, and these factors could serve as a starting point for structuring an intervention. Remember that having a diagnosis does not necessarily mean that you also have an effective intervention. We therefore recommend that if the institution in which the child is placed does not have a specific expertise in autism spectrum disorders, advice should be sought from a facility that does implement specific interventions recognized as valid by international guidelines. The manual is not a diagnostic tool and does not allow you to define whether a child has autism spectrum disorder. In the manual, certain behaviours are described that can be used in the diagnostic process by professionals prepared in diagnosing. It may happen that you observe only one red flag. This means that the child has an abnormality only in that behaviour. However, it is still important to acknowledge what has been observed, to share it with the family and other professionals, and to take the necessary steps to help the child overcome this difficulty. As it is not a diagnostic tool, there is no number of flags at which a diagnosis of autism spectrum disorder can be made. However, it is important to note that the behaviours contained in the manual are those behaviours considered significant for a diagnosis of autism. For this reason, it is important to acknowledge the flags observed, even if they may be few in number, and to communicate them with the family and other professionals in order to support the child and their family. It may happen that even in the absence of red flags, concern remains. The advice is to be able to try to define clearly and objectively what has been observed, what causes us doubt or concern, and to share it with colleagues, with the other professionals involved, and above all, with the family.